Despite observations and pronouncements of the country's testing and contact tracing efforts being mediocre, the latest positivity rate for OCTA Research Group evaluation suggests otherwise. PTV correspondent Mark Vitalco on the current positivity mark hitting its lowest since the pandemic began and well within the international threshold of both the WHO and CDC in this report.
The COVID-19 positivity rate in Metro Manila has decreased to 3% according to the OCTA Research Group. The WHO initially suggested a positivity rate of 5% as a benchmark for adequate testing before regions could safely reopen. According to Dr. Guido David, the low positivity rate in the NCR meets the 3% recommendation of the U.S. Centers for Disease Control and Prevention.
In the NCR, we have seen this 5% level for about 2 weeks now. And in fact, as we mentioned, it's already down to 3%, which is the lowest I think I have seen it in the NCR since the beginning of the pandemic.
In addition to the positivity rate, the average daily attack rate and reproduction number in the region continue to improve as well. The OCTA Group added the cities of Navotas, Caloocan, and Malabon are considered very low risk for COVID-19, while the other local government units in the NCR are classified as low risk. According to Father Nicanor Austriaco, the pandemic status in Metro Manila is comparable to the megacities of Los Angeles and New York in the United States.
The question now arises about considering increasing the mobility of our Filipino citizens and relaxing pandemic health practices to make them more comparable to these two American cities.
Meanwhile, based on a survey conducted by the OCTA Research, while majority of Filipinos still want to get themselves vaccinated, there is an increasing number of people unwilling to get inoculated. The OCTA said some reasons behind the public's vaccine hesitancy include their uncertainty on the safety and efficacy of vaccines, and some believe it is not needed to effectively combat COVID-19.
There are many strategies that can be employed. The important thing is that the last mile, so to speak, our kababayans in DNE, we have to reach out to them and inform them. And I'm very sure once they're informed, they will not hesitate to get themselves vaccinated. It's really access to information more than misinformation. That's the challenge here.
The OCTA Research said cases may decrease further because of the heightened vaccination rollout. However, if booster shots are not given by the first or second quarter of 2022, Father Austriaco said the Philippines may experience a resurge of the Delta variant. Mark Vitalco for The Nation.